Hi guys, we're back. We are going to be doing Clear and Brilliant. So Clear and Brilliant is a staple in our practice because it targets such a variety of conditions, and it's a great treatment for both the younger patient and the patient who wants to reverse some sun damage. So I heard the term prejuvenation as opposed to rejuvenation, and that's exactly what this is. So we're using the original handpiece. Penetrates a little bit deeper than the sister handpiece, which is Permea. Permea is great for pigment. For our patient today, you can see she has a little bit of redness, a little bit of acne that comes and goes, but some scarring from it. She's got, I'm going to turn you slightly, a little bit of pitting, just some mild irregularities in texture. And she's at a point where why not prevent signs of aging? She can improve what she's currently seeing and concerned about, but then also maintain her skin going forward so that she's not trying to fight against such deep signs of aging later. So it's a great treatment. I did a little test spot right here. I always give a small introduction to the patient so they know what to expect. We discussed that it would kind of feel like a cat tongue, feel a little bit prickly, has this little roller technology here. So when it makes contact with the skin, it's going to give this crackling sound as it glides over the skin, and that's how it's evenly distributing the energy. So it's very comfortable because it's not a stamping method, and it will give a little bit of redness in its path. So this was our section, so I'm going to start back up on the forehead. Here we go. So you hear that little bit of crackling, and we're just going to cover the entire area. So can you describe what it feels like on the forehead? I always say it's the worst part. Once we pass the forehead, it's much more comfortable, but how does this feel for you?
It just feels like literally what you said, like a cat's tongue is licking your forehead, but it's really not painful at all.
Good. We don't want treatments to be painful. We want them to be effective. Sometimes there is going to be that overlap between the two, and that's just a matter of kind of the reality of how these treatments work. We're causing micro trauma to the skin. So we take steps like topical numbing to make it as best as possible and as comfortable as possible. But this micro trauma is what allows for increased permeability, collagen stimulation, kind of the method of replacing damaged skin with healthy tissue. So I'll do one more pass here. So laser treatments are adjustable and customizable to the patient, to the skin concern, and the amount of downtime is relative depending on what you choose. So for our patient, she probably will be experiencing about 3 to 4 days of redness. The Clear and Brilliant handpiece in original, it is customizable. You can adjust the depth. I'm going to go ahead and turn you a little bit. You can see where our redness is forming, a little bit of the texture that ensues after treatment. But the depth is customizable depending if you're on low, medium, or high, and it's also coverage. So we treat on high for her. We're going to get a nice strong treatment, but she'll still be able to go to work, get her things done. She can put on some makeup. I always like people to wait a few days. And she'll follow her skincare routine. That's really the most important thing to protect, heal, and hydrate after a laser treatment.
What does it feel like post-procedure?
So post-procedure is going to be some warmth in the skin. That's really what I notice the most, and patients tend to give feedback on. You physically will see the redness, but you feel just this heat that's in the skin that has built up, and that heat is good. That heat stimulates collagen, but it usually dissipates in a few hours. Definitely by the end of the day, you can see the redness starting to develop.
I get red very easily.
Yeah, and that is a really good point. A lot of patients feel that they have sensitive skin, and some people do, and there's sensitivities to treatments, there's sensitivity to ingredients, to fragrances. But something that I want to acknowledge is the thought of reactive skin versus sensitive skin. Skin that reacts with redness is totally fine. Reactive skin just it's your body's way of showing that it is recognizing the treatment and going to have a benefit from it. And so I love when people's skin gets red. It's a great sign.
Well, is it producing more blood?
So,
Like more blood
laser
flow?
treatments, yes, heat increases blood flow. Laser treatments, by nature, increase blood flow. It is definitely making you a little bit more flushed. If you guys want to go overhead, you could actually see split face, a line of where her redness ends. I'll get her nose here, but you can see the treated side versus the untreated side. And this redness is going to subside. We're going to move over here. Are there any questions?
You're asking me?
I'm asking you and everyone.
Yeah, do you have any?
Do you have any?
So how does it help the indentations of the skin?
Okay, so that's a great question. So the way that this treatment works is it's a fractional treatment, meaning that it's not completely treating the entire surface of the skin. So a fraction of the area means just partial. So you are treating, let's say we're treating 50% of the skin. You're causing micro injury to that 50%, and your body registers that injury, heals the injury, and replaces it with fresh skin, new cells, and by nature, more collagen in the area. Collagen responds to injury, heat, just any kind of stimulation. And so all of that is going to replace and generate more tissue.
So then it'll fill in the...
So it's going to fill it in. With fractional lasers, you can adjust the coverage. And so when we talk about coverage, it's how much of the surface is getting treated all at once. More coverage, more treatment, more aggressive, quicker results, also more downtime. With this laser, sorry, the lip is a little nippy. It's a good place to treat.
Probably because of my hair too. I'm very peachy.
There's a lot of nerve fibers around the lips, the nose, kind of near the bottom of the eye. And so it can be a little bit more sensitive. But when you talk about fractional lasers, you are causing micro trauma to some area of the skin, and you are leaving other areas untreated. And so the untreated skin acts as the untouched skin reservoir. And those untouched cells aid in healing the treated portion. And so when you think that you've treated a larger area, it's going to take more time to get the treated ones to turn over and heal. So less coverage will be less downtime. You just might require more treatments. Clear and Brilliant is great as a package, and it's great in combination with others. We've got full face redness. I'm going to move back up to your forehead. It's good standalone and it's good in combo.
How many treatments do you recommend?
So this really depends based on what the skincare concern is, or the skin concern. Sorry, give me a few deep breaths. Your forehead's almost done. The forehead has less fat, so it's a little more sensitive. Couple more passes, just 3 deep breaths. So,
Oh my god.
we're done. That is real life. These can be a little bit sensitive, but the cheek is way better. What was the question one more time? Sorry, we got distracted.
It's okay. How many treatments do you recommend?
Right. So the treatment number depends on what the skincare concern is. So if the concern is scarring, scarring is very difficult, and it's going to take multiple treatments, sometimes multiple modalities, but you're looking at 4 to 6 to get a nice improvement. The studies are kind of based around 4 to 6 for pigment. And, this, not this handpiece, but the Permea handpiece is great for things like melasma, sun damage, sunspots, freckles, and I would, depending on the degree of improvement, about 4 to 6. It to me is something that would be done lifelong. Any other questions? No? Okay, so we have done at least 4 passes on the full face. This is a great treatment. She's getting a little bit more sensitive. You can see how red she is. You can see the one spot that I missed here on the lip. So everything is red except for that one little spot. So it's great to go back and check. You want to be nice and consistent. The full face redness is a great sign. I'm going to do just a couple more passes. Based on her tolerance, we've already hit a great point. We have caused enough of a response in the tissue that she's going to be seeing that improvement. She'll have about a week of downtime, and in the upcoming weeks, her skin will be responding, looking a lot more smooth and a lot brighter, have a great glow. So we'll finish up here. If there's any last questions, you just let us know. But thanks for checking in, and we'll see how she's feeling afterwards. Thanks, guys. I'm gonna get this one little spot.
The more passes, the more results, or what would you?
So not necessarily. More passes ultimately is going to be more coverage. So when we think about fractional, if we think that we're set to be covering 50% of the skin, the more passes you are going to be covering more, giving a little bit more downtime, but you're not penetrating deeper. So it kind of goes hand in hand.